All right, I think we have everyone in our Zoom weekly Wednesday media briefing. We thank you all for being here on this very busy news day, and we're hoping that this resource that we provide each and every Wednesday is especially helpful this week, given the data that the state has shared. So in addition to County Executive Marc Elrich and County Health Officer Dr. Travis Gales, this week we were also joined by Dr. Raymond Crowell, who is the Department of Health and Human Services Director. So Mr. County Executive, if you'd like to begin with just a couple of quick words, and then we will take reporter questions.
So welcome everybody to today's briefing. Dr. Gales will be talking on the medical side of things. I guess just in general, we don't know if we're at peak yet, and we certainly don't have 2 weeks of downward numbers. We are working with the state guidelines. We continue to work very closely with the state on how we deal with the virus going forward. We've asked the state for permission to make modifications to our guidelines on testing, and again, Dr. Gales can talk more about that. And I want to announce that we're about to ask for another $5 million for the EARP program, which was money that was meant to support county residents, those most in need who aren't eligible for unemployment. We have $5 million that's in the process of, that's already been approved, and we're going to be adding $5 million, or asking the council to approve adding $5 million to that sum. So we'll be up to $10 million there. And we have additional funding in the housing department that's targeted on housing support. So I guess I'll stop there, wait for questions, and let Dr. Gales take the show.
Thank you, sir. We don't yet have any questions. And for all the reporters who are attending, yes, you have permission to record always. This is for you. This is your resource. Dr. Gales, do you want to just begin with sort of an overlook at the data that the state released and explain what it means for us in Montgomery County, particularly since you have been sharing that data from the start?
Sure. Good afternoon, everyone. Always a pleasure to join in with you and look forward to your questions. To Julie's comment, what she's referring to is the state's decision the governor's decision to release information regarding COVID-19 cases in nursing homes, long-term care facilities, and group homes. And a significant amount of that information was put up this morning. I want to, hate to keep using that word again, I want to level set your expectations and provide additional context. So as Julie referenced, we were providing that information in the early stages. In terms of number of cases, we actually reported with our first wave of cases involving nursing homes. We published that information and put that out. I want to underscore, even in the time where we were directed to not release that information has always been shared with the facilities. And we have worked with the facilities to make sure that the families of patients who have tested positive have been notified, and also encourage them to notify their broader community of other residents and staff and family members. We have worked very closely with the nursing homes and long-term care facilities, starting back before, as some of you remember, before we had cases present. We provided guidance for them. And as the process has evolved and time has evolved, we've continued to make sure that they have access to the most recent up-to-date guidelines. The majority, if you look at those high volume facilities in Montgomery County, the overwhelming majority of those facilities that are defined as hotspots with 30 or more cases were from the very early stages. And so back in late March and early April, during that time, since then, we have had more strict guidance that has been put into place in terms of requiring to take patients who are positive and keep them in one dedicated area of the facility, making sure that staff wear personal protective equipment when dealing with all patients, and also other recommendations such as making sure that they're dedicated staff to work with those patients who've tested positive. We created back at the end of March, March 31st, when we had our first wave of nursing home affiliated cases, we created a local action team. Those local action teams, as you can recall, and we've shared some of these details, included some of our disease control staff, as well as our nursing home regulatory staff that work regularly with nursing homes and long-term care facilities to provide an additional layer of support. That support includes all of the things that I just mentioned, making sure that they're following infection control guidelines and doing everything that they're supposed to do in terms of keeping their patients safe and mitigating transmission. The following week, the governor announced the state version of action teams, and those teams have been active across the state providing additional support. In addition to that level, there's been a third layer where we've had colleagues from the State Department of Health also come in and do site visits on a number of different facilities. So I say all of that to say that we have been actively working from the very beginning and throughout this process, continuing to evolve our level of outreach and support, again, based upon the most recent guidelines and up-to-date guidelines. I want to again provide that context, because when you look at the numbers standalone, it can give the inference that we haven't been actively engaged. That's just not an accurate depiction. So I wanted to put that context in place. We have been aware of the numbers, and we've been working with the facilities to mitigate transmission, and happy to answer any questions that you have regarding that, or any of the other numerous things that we're working on in terms of our efforts to increase testing capacity, build outreach in communities related to address the social determinants of health needs in communities that we know can predispose folks to transmission and also complicate their trajectories, our surge planning, as well as our efforts to increase our local contact tracing efforts to, again, implement strategies to mitigate transmission. Thank you.
Thank you, Dr. Gales. Rebecca Tan with the Washington Post is up first. Rebecca, go ahead.
Hi, as always, very grateful for these sessions. I have a question for Dr. Gales, Dr. Crowell. Generally speaking, why do the long-term care facilities in Montgomery County constitute such a large percentage of the cases and deaths? We see that more than 2/3 of the deaths in Montgomery County are linked to nursing homes, compared to just over a quarter in neighboring Prince George's County. Would love if you guys would be able to talk a little bit more about that. And I have a couple more questions on nursing homes, if that's okay.
Well, Rebecca, to your first point, I think it's important to understand why are nursing home facilities and long-term care facilities highly vulnerable and susceptible to outbreaks. As I mentioned, the majority of our facilities that have been involved had cases early on in the process. So that was before we had more up-to-date guidance to suggest that individuals who were not demonstrating symptoms could transmit coronavirus. And as you recall, back during that time period, all of our criteria and frames of reference, even when we were testing folks for temperatures and coming into facilities, potentially missed those folks. Since we did receive that guidance, as you know, up-to-date procedures have been put into place in terms of requiring face coverings at all areas within facilities, as well as personal protective equipment and when working with residents throughout the different facilities. And so it's susceptible because you've got a highly vulnerable population anyway, based upon a number of their health conditions, as well as their ages, that can complicate and have a worse outcome related to COVID-19. Additionally, you've got a lot of folks in a concentrated space. And so it makes it potentially easy if a case is introduced into that environment. It is a perfect setup, so to speak, in terms of cases spreading. So I say all of that to say that highly vulnerable population in a concentrated space, up-to-date guidance put into place. But when you talk about deaths, it's tricky to compare to other jurisdictions. So when you talk about deaths, again, you've got a highly vulnerable population with complicated medical histories, and also age is a significant factor in a number of those cases as well.
Hi, sorry. Thank you for that. I was wondering if you could, we understand why nursing homes sort of are vulnerable settings for the virus to spread, and how the people there are particularly vulnerable. But we're wondering, compared to any other jurisdiction in the state, with the exception of Carroll County, Montgomery County seems to have a large percentage of its deaths related to nursing homes. And we're wondering, is there a reason for this? What have you guys assessed as the factors for this?
I think I was pretty clear in my answer in terms of demonstrating the factors that lead to and predispose individuals in nursing homes. I think you also have to take into consideration the volume and number of facilities. For example, we have over 303 facilities that qualify for nursing homes, long-term care facilities, and group homes that fit into this description. So there are a lot of different factors that influence that. I want to make it clear, though, and emphasize again the efforts that we've put into place again in the very beginning stages of this, again, to make sure facilities had the support that they needed. Even before the state took action in terms of creating action teams, we had those on a local level. And we've continued to use those as best as we can to provide the additional support. So I think it's a host of factors, including the age, the medical conditions, as well as the volume of facilities throughout our county.
Got it. And one quick,
I'm sorry, we've got like 6 people lined up. We will, like we've done in the past, we'll come back.
All right, thank you.
Suzanne Pollock with Montgomery County Media is up next. And for all the reporters who are submitting questions, if you could just say question for Dr. Gales about nursing homes, question for County Executive Elrich about such and such, that would just be helpful for us to help moderate. Thanks.
So Suzanne Pollock, so this is for Dr. Gales about nursing homes. When you went in to the different homes to make sure or to help them with their wearing the right gear and what they do, did you find that most of them were in compliance, or was it all very new to them and they weren't wearing anything? Or what was it like at first?
So I think, again, it may complicate things, and I may get in trouble with Julie on this, but I want to answer this within the historical perspective. So back weeks ago, at that time, our guidance was that if you were asymptomatic, you don't transmit the disease. So at that time, we were not requiring folks to wear face masks or face coverings. At that time, outside of standard isolate or infection control, we weren't requiring people to wear personal protective equipment when they were working with all different patients. Now, as we found out more information, those strategies have been put into place. Those came in towards the later end of the first week of April. If you look at the majority of our facilities involved, unfortunately, a lot of those initial cases happened at the end of March and early April. And so even though those cases have been there and we recognize that and we've been working on those, since those tougher precautions have been put into place, we haven't seen a huge level of transmission in facilities. Certainly we have seen some, but I want to emphasize kind of the historical perspective of how this has moved forward and why some facilities may have more cases than others. So it's tricky. So in those initial settings, the guidelines were different. And so now moving forward that we have stricter guidelines in place in terms from an infection control perspective, quarantining and isolating patients separately, removing any type of group activities, dedicated staff for patients who've tested positive. In those cases, we're finding that the majority of facilities are adhering to the infection control practices. They are using PPE. Now, we know that PPE the availability of that is a concern across the country. The state has released multiple provisions of PPE specifically dedicated to our nursing homes and long-term care facilities. When we've received those, we have allocated them immediately to those facilities. And I think the last component I would say is I think one of the big issues has been staffing. Because you can imagine if you've got a number of staff who are out due to being quarantined or different reasons, that can create some challenges. And so we have been working, the state has created a staffing program to be able to help and add some additional assistance to facilities where staffing is an issue and a concern.
You'll never get in trouble with me, Dr. Gales. The facts are the facts. Dario with Telemundo, you are up next. Dario? Dario, can you hear us? Going once?
Yes, I'm here right now.
Here we go.
So I have a couple of questions for the doctor and one for the executive, Elrich. For doctor, what is the protocol with patients and workers in these facilities? Because we know a lot of workers are Hispanic workers. And what is the protection that they are to giving to these workers? And for Executive Elrich, I had the opportunity to talk with some of the workers in one of these facilities, and they are some afraid because of these conditions. So if some of them decide to not go to work, they could have any problem. They could be fired. Thank you.
I'll answer the medical one really quickly. So in terms of the protocols, so when we find out that there is a case in a nursing home, our disease control team contacts the facility. There's an in-depth investigation to determine who are the patients who have symptoms, who've tested positive. And we create what's called a line list. And that's literally, you can think of it as a spreadsheet of all of the known cases, those individuals who've come into contact with the known cases, including residents and also including staff. And again, now that the process has moved forward where we're keeping residents separate from everyone else, we make sure those policies are put into place and adhered to. So as it relates to the provisions of workers, so all workers have to wear face coverings. Anyone in the facility has to wear face coverings. And then when interacting with patients, you have to have personal protective equipment when you're moving from patient to patient. That includes gowns, masks, and gloves in those particular settings.
Sorry, this is County Executive. I'm going to have to get back to you on what a worker's rights are. If they're being provided protective equipment, which is required, I'm not sure they've got the option of just saying they're not coming to work. But we can check on that. I don't know if there's a medical reason, if they're at risk. I think there are exceptions for that, but I'm not sure you can do it if they're providing the equipment, but we can follow up on that.
Perhaps Dr. Crowell, would you have that information?
I don't have the information specifically about this case, but I would say to you that one of the expectations for the providers that we work with is that their staff will come to work. It is a choice for an individual to decide whether or not they feel comfortable working under the conditions that are set and whether or not they have adequate protective gear. That if they decide that they don't want to come to work, then I think they have leave options, or the provider may need to figure out how to staff up to continue the operation, and that may mean that some folks might be laid off.
Okay, thank you, Dr. Crowell. Heather Curtis with WMAL has a question for the county executive about union contracts. Go ahead, Heather.
Hi, County Executive. How are you? Thank you so much for talking with us. So my question is, obviously you're working on renegotiating these contracts. What do you think needs to be renegotiated, and what do you expect to accomplish at this meeting with the unions on Friday?
We're continuing to talk with them and this was, they came to us and suggested that we have this conversation. We've kind of laid out to them what we think our physical situation is going to be for this year and for next year. We've been very blunt with them about what we think resources are, and they are going to be making proposals on how costs can be reduced. And I'm hopeful that we'll get modifications that result in reductions in spending this year.
Thank you, Heather. Kate Ryan with WTOP, back to nursing homes. Go ahead, Kate.
All right, there we go. I had a question about whether or not people have the supplies they need at the nursing homes. And I think you've already addressed some of this, but I wanted to double check on that. Do they have all the PPEs, the masks, ventilators, not ventilators, I'm sorry, the type of face masks they need and gowns? And do these staff members migrate between different settings? In other words, my understanding is that some nursing home employees work at multiple facilities. Are they being tracked that way? Do you have a handle on that?
Yeah, so to your first question, in terms of personal protective equipment, yes, that encompasses all of the things that you mentioned. without ventilators, with a respirator mask. So mask, gowns, gloves, and those provisions. And so, as I mentioned, we provide them with provisions from the county, but the state has continued to support that. And after the secretary's directive requiring that PPE be worn with each resident, the state has provided multiple provisions of PPE for us to allocate and deliver to the nursing homes. The second question in terms of do we have a handle on the employees? So one of the things when we first started noticing cases was that was a reality, and several of the facilities implemented strategies and policies that required their workers only work at one dedicated facility. Now, as we've moved forward in the contact tracing process, we monitor, and again, that's part of the thing, making sure that we have a handle in terms of where a person was and who they're coming into contact with. So we know that is a provision of many other facilities throughout the county, requiring that individuals focus on one facility as opposed to moving to others, because as you can imagine, that could potentially increase transmission in multiple sites. We're doing our due diligence now as part of the contact tracing process, is to go back and review to see if there were any common denominators across any of the facilities. So the best way to answer is yes, we have a handle on it. We are aware of it, and there are policies in place to minimize that as best as possible.
Thanks, Dr. Gales. The next two questions are also medical questions. Up first is Brianna with Bethesda Beat about testing.
Okay, great. So I had a question about the 500,000 tests from South Korea. Have you all gotten any update about when you are going to receive any of those tests, and are those tests complete?
So we haven't received an update. The tests were not complete. As the governor mentioned himself, the kits did not come with a host of other things needed for the full process, including nasal swabs, as well as reagents to run them when they're processed in the lab.
And you also have to have labs that are capable of running their tests. Otherwise, you will have a longer wait if you have to send the tests out to other labs. I just want to clarify, we've gone down the rabbit hole with any number of different tests. I can find tests sometimes, but oftentimes, most of the time, people don't have either the reagents or they don't have the swabs, and so the tests are sort of like paperweights until you get to the point that you can actually utilize them. And tests are also particular to the machine they're run on. And so we found tests, and we had a conversation with hospitals about a test we found, and none of the hospitals could run the tests that we found in the hospitals. And we were hoping that we'd be able to use their capacity to run a larger volume of tests, and that proved to be also a dead end. So we're continuing to pursue them. We're going to persist until we find stuff. And we're also looking at what we might have to do on our own to assure that we're not dependent on other sources, because it's important not only for this period, but for going forward, that the county not be like a lot of places are where you're on an allotment. And I've talked to multiple vendors who've said either we can't get anything, we'd have to get in the queue to buy something, or if we were in the queue to buy something, we're all on an allotment, and it's not like you can get whatever you want or whatever you need. So we need to evaluate how we can avoid being in that situation going forward.
All right, and I apologize to Chris Gordon over at Channel 4. I missed you several reporters back, so you are up next.
Well, thank you very much. I have a question for Dr. Krause and a question for the county executive. Dr. Krause, Dr. Gales gave us a good recitation of the early stages and some of the changes. But people, when they hear that Montgomery County has the highest number of cases and deaths, question is simple. What are you trying to do to get this under control?
Good afternoon. Thank you for the question. This question is for me as Dr. Kroll. Yeah, it sounded like so. I think Dr. Gales has talked a lot about the things that we are doing, and I think the county executive has as well. Flattening the curve is a process of encouraging residents to stay safe, stay out of harm's way, to follow the guidance that Dr. Gales and the CDC has put out for us continuously over time. I think that the action teams that Dr. Gales has talked about represent an opportunity for us to go into the communities, to do the contact tracing and do the monitoring of folks who are positive, but also to help them stay isolated and stay self-quarantined, I should say, to keep other folks from being in harm's way. You're blocked off. I'm sorry, you're muted. Looks like you were asking something. You're muted. Okay, so I'll continue on that.
Talking to my producer at the same time.
Say it again.
I'm sorry I interrupted you. I was making a comment on the phone.
Oh,
third
okay.
party.
Yeah, sorry. I think that as the action teams roll out and continue to roll out, one of the things we're doing in concert with the state is identifying people who have needs that go beyond the immediate medical needs for other humans, for other services. So rental assistance is an example of that, utility support, food support for folks, and cash assistance like the emergency assistance relief plan that you heard about. Trying to make sure those folks are connected are some of the things that we're doing to keep people safe, to keep them following the guidance that's been put in effect at the state and local level.
I think Chris had a follow-up for the county executive, and Dr. Gales, I don't know if you had anything else to add on what we are doing to help the folks in the nursing homes and long-term care facilities.
Yeah, if we could give Dr. Gales an opportunity, just, what's being done, in a nutshell, what's being done to get this under control?
To borrow the term earlier, I mean, I think I've been pretty clear in terms of describing the steps that we've taken and explaining why the numbers are where they are in terms of the historical evolution. I've also explained how we have tailored and adjusted our approach as more information has come in from a surveillance perspective. One thing that I did not include in describing how the action teams go in and work with the nursing homes is the testing component. So I've heard, I receive emails and say, well, we're not testing people. How do we get access to tests? So if they're based upon the CDC guidelines and the state guidelines, testing for individuals who are developing symptoms is happening. And that is going directly to the state public health lab. We are looking, as you know, the CDC released new guidelines that talked about asymptomatic patients and what we would potentially do for that. We're having conversations to talk about how we could potentially adjust that criteria on a local level. And as it relates to the other component, so that's testing the residents. So as it relates to the other component in terms of testing staff, we have worked with facilities to help get them access to testing, whether it's leveraging their relationship with private labs that they use for their other services to make sure the staff get tested either potentially there, or working to help them facilitate testing through their primary care providers or other mechanisms throughout the community, whether it's through an urgent care facility or some of our alternative testing sites.
Thank you, Dr. Gales. Chris, you had something for the county executive as well, and then we'll move on.
I just wanted to ask the county executive, because we've heard from governors who say they've gotten into a bidding contest for equipment and testing. Do you think that a global pandemic needs a federal response or state, county, and local responses?
I mean, the federal government has the ability to marshal production of things, and that's what they've absolutely failed to do. I mean, it wasn't like there weren't test kits out there. They could have commandeered people who had machinery in factories that could have produced those kits and those products elsewhere, rather than relying on, the current suppliers to try to make their supply stretch to everybody. If you think about it, nobody was building a supply of vaccines or anything for a 300 million person population. They treat specialty diseases. They never do things of this magnitude. What we really needed was a decision that we were going to have people produce the kits that we knew would work and get those out there. And that decision utterly failed. So when we go out and look for things, and I know council members have looked for things, I've looked for things personally. I've called companies and had conversations with, their leadership, and it's all, people are on an allotment system and they don't have enough. This should have been dealt with when the president had the warnings back in January and February of what was coming. They should have put these pieces in place, and it might have been nice if they had shared those warnings with everybody else, because to be caught in this when people knew this was coming is really frustrating. But we're going to continue to try to find things, and we're searching the world. We're not limited to what's in our backyard. We're looking for places beyond our backyard.
Thank you, sir. Rebecca Tan with the Washington Post, you're up next, and we've got 3 other reporters lined up right behind you.
Thanks, Julie. 2 quick questions. Last Thursday, we were told that there were 400 cases linked to long-term care facilities, and now the state data shows that there's more than 1,000. So I'm wondering, how did that jump happen? Was it more testing? Are these all new infections? What is the discrepancy between these 2 numbers? And then the second thing is that I'm interested in learning more about the action teams and the state strike teams. How many has every single nursing home in Montgomery with an outbreak been assigned a quote-unquote action team from the county? And secondly, how many facilities have received support from the state's strike teams? And are you looking for more support from the state when it comes to nursing homes?
Okay. So I will actually, there's a lot of questions, so I'm actually going to have you repeat your questions after the first one. So in terms of differences in cases, so part of it is we need to break down, and what I want folks to also understand, the way the state has released the information, it does not break down the number of cases by residents and staff members. It is a aggregate number. And so the data needs to be, I want you to understand that when they're talking about all these cases, it's including staff, it's including residents. And so I can get back to you as we break that down to get a specific number to address that question. So in terms of new cases, in terms of new outbreaks in facilities, we haven't seen a significant increase. I think we could just have had some old data, which is possible, because remember, there has been a gap between when we last reported nursing home cases to the public and now. So there's been a few weeks between when those old numbers were released and to where we are today. And so when we talk about involvement of local action teams, so when we hear about a case at a nursing home or long-term care facility, that is assigned to one of our senior disease control investigators. When that person reaches out to the facility, we also engage our local action team, which is made up of nursing staff from our nursing home regulatory services component. They all get some level of conversation, investigation, support, consultation, and triage. That does not mean that it's a physical in-person visit. So there is virtual support and consultation with both of those levels, the disease control team coordinating the investigation, as well as the nursing home action teams providing follow-up and guidance as needed from the facilities. Now, there are instances where we do recognize to say there's a lot of cases at this facility. Are there any red flags that are jumping up that necessitate us to do a closer level of follow-up, whether that's in-person, daily huddles? The disease control investigators do call and talk with the facility leadership on a daily basis to get updates and triage where they are. That sometimes, again, involves in-person visits to the facilities. In addition to that, I'm looking at my notes here. We have had 9 strike team visits from the state action team. Sorry, I'm mixing them. So there's been 9 visits by the state action teams to our facilities. The way that works is we identify a place as a potential hotspot. Sometimes the facilities say we could potentially benefit from it. And the third component, sometimes the state says, hey, there's a high number of cases here. We'd like to send a team. That is requested. The state reviews the request. They honor the request, and they visit the facility. After that visit happens, they create a summary report that says, hey, here's what they're doing well. Here's the areas of concern. And what we do on the local level is we look at that report and say, here's what we can do to help step in and help facilitate some of those areas of remediation. And so that's kind of how the process goes. That's where we've been. And I will add to that, there have been at least 6 or 7 other visits where state staff have come in and done one-on-one site visits that don't involve the larger action teams. So all of the homes that are on the hotspot list have had extensive work with our local teams and in some cases, in-person visits from the state action teams.
Okay. Thank you, Dr. Gales. Heather Curtis from WMAL Radio has a follow-up.
Elrich, I'm wondering, union negotiations in all sectors can take a long time with a lot of back and forth. Is there a deadline you have for renegotiating these contracts?
There's a deadline. There's some flexibility to the deadline, and we're asking the council to defer for 2 weeks any action on their part, so that the period that then is a mandated time limit isn't triggered, and we're not forced to condense everything down to a few days, fewer days than we would like. So we're going to ask them not to take any action, but to defer action on Thursday, and that'll give us more time. Because if they simply reject the contracts, then what happens then is that there's, I think it's a 10-day clock or something like that that starts running. So we want the denial of the contracts to come as late in the process, so that we've got lots of time to have a back and forth and discuss this.
Okay, and Kate Ryan, you will have the last question as we are coming up on 45 minutes for this media briefing. Go ahead, Kate from WTOP.
I appreciate that. Thank you. I'm looking at the BAL-TV had a report on the test that came out of South Korea, and there were concerns that the Lab Genomics was the company that shipped the tests here, did not have FDA approval to ship those on an emergency basis, and the FDA had not yet cleared them. Tuesday night, the governor's spokesperson, Mike Ricci, issued a statement saying the FDA did clear the tests to come into the country, and they have been validated. Do you have any update on what that situation is? Are those tests, as far as you know, good to go?
Well, I think to the earlier question, I can't comment on the specifics of that FDA process that they went through. What I can say is that, again, we're still awaiting more details in terms of how the tests will be operationalized and how they will be disseminated to local jurisdictions and what guidance we will receive in terms of how they should be used. I want to also take this opportunity, we didn't really talk a lot about testing capacity, but as to County Executive Elrich's earlier point, we're not necessarily relying on those test kits to solve all of our testing issues. We continue to pursue other options through leveraging new partnerships with private laboratories, as well as look at how we can leverage some of the newer technology. It's funny you mentioned that whole notion of FDA approval. In the setting of a pandemic, there's been lots of stuff that has moved forward with expedited reviews or not full reviews, and that's part of the challenge. Is when we hear about new technologies or we hear about, test X or test Y, we're trying to very quickly vet them to see if they're credible, if they meet the scientific stuff in terms of being able to move forward, and figure out how we can best utilize those strategies to meet the needs of our residents.
Okay, and Randy Bass, you have the final question because we still have 2 more minutes. So go ahead, Randy.
Hello, can you hear me?
Mm-hmm. Yep.
Awesome. Thank you so much. And I hope everybody on the call is well this afternoon. I'll direct this question to Dr. Gales, but if anybody else would like to chime in, that is fine. It's a really hard time for many of us and for our healthcare workers, especially from a mental health standpoint. What support is being provided to healthcare workers, not only in our nursing homes, but also in our hospitals?
Well, I think, and we have Dr. Crowell here, and he's a behavioral health specialist. His background, so I will answer briefly and defer to him to share some of his expertise. But I think briefly, part of it is I know different institutions are providing services to help support. This is a very exhausting process. Unfortunately, we received news earlier this week that Dr. Bren, who was the head of emergency services at NYU Presbyterian, committed suicide, having survived COVID-19 herself. and provided significant amounts of care to thousands of individuals in New York. It's heavy, it's not easy, and there's no playbook for any of this. And so it is a serious time, and that your question underscores the need for additional services. I'll shift and pivot to Dr. Crowell if he has any additional thoughts.
Thank you, Dr. Gales. I think this is it hits all of us, and it's hitting everybody. It's hitting the county staff, it's hitting the hospital staff, and anybody who's providing service on an ongoing basis and putting in these long days and hours is experiencing this. I know that the county's employee assistance program has an enormous number of resources for staff when they're feeling stressed or feeling anxious that they can call and use, and for emergency medical supports as well. The hospitals also have similar kinds of programs that are in operation for them. This is responder fatigue, and it is the kind of responder fatigue that we saw during 9/11 in New York and for many months afterwards. So this will be with us for an extended period of time. I think that the county, of course, maintains crisis hotlines and warm lines for folks that they can call in, and that anybody can call in and talk to folks if they have a need. Or their family members can call and talk if the person themselves is feeling reluctant or they just have some concerns that they want to voice. So there are resources available. I do think that it is important for everybody listening and watching to figure out how you help your family members and yourselves to take a moment and de-stress, perhaps by backing away from what you're seeing on the news and the media. The information that Dr. Gales puts out and comes out from the CDC is important information, but past a certain point, looking at it and watching it endlessly and obsessively is not going to help people to de-stress. And folks who are working on the front lines of this really need to take a break and need to step back. So it's a message to folks that they need to do that for themselves, but also that family members need to watch out for them as well.
It's a great point for all of the reporters who are immersed in this 24/7, whether they're on the air or about to write an article and you're doing all the research that you're doing. So appreciate that point, Dr. Crowell, and Dr. Gales, we appreciate your expertise, and County Executive Elrich. This has been a really fascinating, wide-ranging conversation, and we will see you all here again next Wednesday, same time, same place. Take care.
Take care.
Thank you all.
Thank you.